Start here first. A number of businesses have implemented mandatory vaccine policies, and the president has tasked experts with investigating whether the country as a whole should implement this. But is it really necessary? There's been the debate that's been ongoing on social media or even in around your circles. So Wits vaccinology Professor Shabir Madhi joins us now to have this conversation. Prof, always a pleasure to have you on the South African Morning. Good morning to you. Is it necessary to have vaccine mandates in this country?
Good morning. So it's absolutely necessary for South Africa to have a much higher coverage than it currently is, both in terms of direct benefits as well as benefits to society as well as the economy. So the more people that are vaccinated, the less virus is likely to be circulating, which means we're going to end up with fewer cases that end up in hospital, putting less pressure on our healthcare facilities. In addition to which, it's also important to recognize that at least for the Delta variant as an example, and even more so for earlier variants such as the Alpha variant, vaccines do protect people from being infected. And when there are these breakthrough cases, those breakthrough cases in people that have been vaccinated are less likely to transmit the virus than unvaccinated individuals. So certainly from that perspective, it is important for us to get our coverage up to about 80 to 90%. And based on how we've been struggling to get to that level, it appears that this sort of policy is now required.
Yeah, and you're talking about the ideal percentage being at 80 or 90 in terms of the number of people being vaccinated, but stats tell us that that number is at less than 30% of those who are vaccinated at the stage. Prof, where are the areas in South Africa where we are seeing less people rather getting vaccinated?
So I think it's across the board. Even in people above the age of 50, only having 55% of people vaccinated in that age group is really a poor showing. For that age group particularly, if we are wanting to relieve pressure on our healthcare facilities and avoid further restrictions, we're needing to get that vaccination coverage above 90%. But then where we struggle even more is people under the age of 50, and particularly the 18 to 45-year age group, where I believe it's only about 25% of people that have been vaccinated, despite vaccines now being available for almost 3 months in that age group. So it's across all age groups, much more evident in the younger age group, but even in the older age group, we are not coming anywhere close to where we should be in coverage.
In terms of South Africa's mandate, what do you think it should look like? Because we know that at this stage, different parts of the world, vaccine mandates are in policy. You cannot enter certain public, areas without, a vaccine certificate, any proof that you've been vaccinated, or else obviously you have to stay at home. But for some more South African context, because we know the president is still consulting more about whether this is even necessary or not, or even can be done. In your opinion, as an expert, how do you think this can look like or should look like?
Well, the most important thing when you're looking at the mandate is really to, in addition to the individual level protection that you're trying to confer, as I mentioned, the most important thing that you do is trying to limit transmission of the virus. And most of the infections that do take place anywhere in the world, at least 80% of them are either directly or indirectly related to indoor spaces. And those sort of indoor spaces include your shopping malls, your cafes, your bars, your shebeens, as well as public transport. So any time when there's going to be people that are going to be gathering in meaningful numbers, those are the type of spaces where people need to be obliged to be able to demonstrate that they've been vaccinated to get into those spaces.
All right. Well, Prof, we'll have to leave it there due to time, but thank you so much for speaking to us. Professor Shabir Madhi is talking to us about the urgency of, vaccine mandates at this point, but also how necessary it is to protect yourself and those around you.